It's Lindsay Smith Rogers. Thanks for joining us for Season 7 of the podcast. We'll be off for Memorial Day and returning Wednesday, May 31st for the first episode of Season 8. But first, a quick note about one of our other projects, Expert Insights. From the same team that has brought you the Public Health On Call podcast since March 2020, Expert Insights began as a daily newsletter rounding up everything we knew about COVID in that moment. Over the last 3 years, the newsletter evolved, and in 2023, the project won an Anthem Award for being a go-to public health resource. Framed by Bloomberg School researchers and rooted in science, Expert Insights informs readers about the most pressing public health topics. If you're not already, please consider subscribing to this twice-weekly resource. Visit publichealth.jhu.edu/subscribe or click the link in today's episode description and sign up today. Finally, some thank yous from this season of the podcast. Major thanks to Grace Fernandez for stepping in as producer while I was out on family leave, and to Annalise Winnie and Rachel Burvell for their work co-producing Public Health in the Field, the series on Black maternal health. Thank you also to our faithful team of interns, Kriti Baum, Hannah Bennett, and Caroline Wang. Finally, we'd also like to thank you, our listeners, for sharing your ideas and questions and for downloading this podcast nearly 10 million times. Keep writing us at publichealthquestion@jhu.edu, and thank you for being part of this podcast.
Welcome to Public Health On Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, a special episode featuring two brand new graduates of the Johns Hopkins Bloomberg School of Public Health, both of whom studied critical issues related to mental health in the United States. Rather than tell you all about them, I'm going to turn to Dr. Josh Sharfstein. Let's listen.
Good morning, Jamie Schaff, or should I say the recently minted DRPH, Dr. Schaff.
Thank you so much, Josh. Happy to be here.
So could you introduce yourself to our audience and maybe talk a little bit about why you chose the field of public health?
Oh, absolutely. So from my perspective, the field of public health is in everything that we do. I think that every single job I've ever had has been related to public health, whether I was doing administration, human resources, or designing a pilot project for an underserved population. One of the reasons that I chose public health, honestly, I was a kid and I heard about the genocide in Rwanda, and I decided that's something that I want to do. I want to help populations in need, and so I dedicated my career to doing that.
And you started in humanitarian health.
That's right.
Tell me about that.
So I started my career doing humanitarian aid interventions. I worked on, at the time, this was a technologically advanced project using text message technology in Ghana. I then worked on a malnutrition project in India that I had developed while I was doing my master's in public administration. And then I went into more emergency response work with Doctors Without Borders, serving refugee crises, different types of health emergencies across the globe, and then working on more long-term projects in Pakistan and Tanzania.
Well, that's an incredible set of experiences. And at a certain point, you decided to go on and get a doctoral degree. And that requires delving into a particular topic at great length and writing a dissertation. And you have written the dissertation, you have defended the dissertation. That's why I called you the recently minted Dr. Schaff. Tell us what you chose to focus on in your doctoral program.
Yeah, I'm so excited to have been able to do my Doctor of Public Health here at Johns Hopkins. I focused my dissertation research on the mental health of multi-ethnic and multiracial populations. So after my last really long-term humanitarian assignment, I decided to go back and retrain as an epidemiologist, and I studied psychiatric epidemiology. And then I went to go and work at the New York City Health Department. While I was at the New York City Health Department, I found that there were so many things that I could do for the populations and that there were other opportunities that I could do if I advanced myself academically. The Doctor of Public Health program at Hopkins it's really fantastic because you can continue working while you're advancing academically. And it was a really great program for me at the stage of my life that I was in. So my dissertation is focused on racial multi-ethnic populations. I myself am multiracial and multi-ethnic. I'm Chinese and Italian. And I thought that this was something that I wanted to do. And it wasn't really until I was in the COVID response in New York City, where I served as chief data scientist, that I really saw that this is an unmet need. We had so many millions and millions and millions of entries of data, but we didn't have any information on multiracial, multi-ethnic populations. And you ask a couple of questions and you see that it's really a systemic issue, that there are populations that are routinely excluded and concealed within our existing data systems that are really deserving of health and that we don't know a lot about their health needs. So I took on that activity with my dissertation, really looking to see the impact of things like potentially traumatic experiences and prejudice events on our populations that are multiracial, multi-ethnic, and to see what the mental health status was.
It seems like not a day goes by that we're not reading some report about the stress and mental health strain affecting the population. Tell us about what you found among people who are multiracial and multi-ethnic in this regard, and what insights you've drawn from that.
Yeah, the CDC's Household Pulse Survey on Mental Health has provided us a real glimpse on the status of mental health within our populations here in the United States. In every single entry, there's this one group that has the highest prevalence of symptoms of anxiety and depression. And that was this group that was people of two or more races or other. So people of two or more races are multiracial, and they're often grouped together with the other category because of small numbers. So my study really looked to see, are we seeing the same thing when we just look at larger populations of multiracial folks? So what we saw was that we did have high prevalence of symptoms of anxiety and depression. We also had what could be 9 times the population average of symptoms of post-traumatic stress disorder and suicide attempts.
Did you just say 9 times?
I did. I said 9 times.
That's an enormous increase in risk, if that is in fact the case.
It really is. My study, we were fortunate to do 2 rounds of quantitative data collection. So we were able to see if this replicated in a completely different sample, and it did. These findings are really astonishing, and they indicate a really high burden of mental illness among multiracial, multi-ethnic populations.
What do you think may be related to that?
So many things. So in our study, we explored strength and ethnic identity, we explored social support. And the benefit of my study is that it's participatory and it's also mixed methods. So in our qualitative study, we really explored some of the areas that we couldn't get to with our quantitative study. And what we found was that multiracial, multi-ethnic populations are routinely rejected by pretty much every community. They're rejected by monoracial communities, they're rejected by white communities, and unfortunately, they're also rejected by their families a lot of the time. And that creates an environment where one of the strongest protective factors is social support. And so you have an entire population of people that's having a hard time finding social support, that's having a hard time finding where they belong in society. And that's really all of these things that we know can be beneficial to people's mental health, they really don't have access to.
What's next for your work? And are you thinking about exploring ways to help with this problem?
Yeah, so my study was in adults, and I think what our findings really showed is that because multiracial, multi-ethnic populations are growing exponentially over time, we really do need to expand this work to really understand the mental health status and needs of children, youth, and families that are multiracial and multi-ethnic. So ideally, we would expand this into those populations and really understand what we need to help support these populations. This dissertation work also highlighted a really ongoing issue, which is that there are populations that are excluded, that are underrepresented in our existing public health data systems. And as we move towards data-driven resource allocation, we really need to consider how to allocate resources to populations that are chronically excluded or underrepresented within our existing infrastructure.
Well, it seems like you're shedding an incredibly important light on this problem that has been hidden in a way because it's the bottom of the survey and not focused on until now. It's incredible. From your humanitarian work to your work in New York City during the pandemic to this fascinating and important project. It reminds me when people ask me what it's like to work with students at the Johns Hopkins Bloomberg School of Public Health, I always answer, it's humbling. It's really incredible, the work you've done. And thank you so much for sharing it with me and with our audience.
Yeah, thank you so much for having me.
Good luck with the graduation ceremony and everything to follow.
Thank you so much.
Hello, Dr. Smith. It is great to see you. How are you doing today?
I'm doing good. Thank you for having me.
Not that many people have called you Dr. Smith yet. Is that right?
Yeah, it's new. I'm still getting used to it.
Well, congratulations. Could you introduce yourself to the Public Health on Call audience?
Sure. I am Bianca D. Smith. I am originally from Lansing, Michigan. I went to Michigan State University for my undergrad. Then I received my Master of Public Health in Epidemiology from the University of Georgia, worked at the Michigan Public Health Institute for a time before I came back to Hopkins for my doctorate.
Now, why did you decide to get a doctorate in public health?
I really wanted to do research on neighborhoods. So a lot of my background was inspired from my personal experiences just growing up in Lansing in like an impoverished area and just really wondering why things were happening the way they were. So I really wanted to put things like structural racism, social determinants of health at the forefront of research to really understand like urban health and the health of people of color.
That's tremendous. So how has it been for you studying those issues at Johns Hopkins?
It's been really good. I really appreciate being able to focus on those issues first and foremost and really dive deep into the historical context of structural racism in the US and really bringing in this holistic view of like the neighborhood and different systems. And I specifically looked at housing discrimination. So really how like housing places itself in health and how we connect to mental health.
I think you're making an important point. You know, when people go to a school, sometimes they think, well, they'll tell me which classes to take. But certainly for a public health doctorate, it's a lot about what you're interested in working on. So housing discrimination, tell me about your dissertation.
Yeah, so my dissertation looked at the relationship between structural racism and the form of housing discrimination in Black mental health in the US. So I used a couple of methods to do that. So I did a scoping review that looked at housing discrimination in the forms of redlining and gentrification across all mental health outcomes that are out there in the literature. Then I used geospatial methods to look at the relationship between redlining and gentrification in Metro Detroit.
Tell me about the history of redlining and gentrification in Metro Detroit.
Redlining began in the 1939 in Metro Detroit. And really what redlining is, it was a federally sponsored form of mortgage discrimination lending in the US that lasted about 30 years. And gentrification is when a neighborhood that was disinvested experiences an influx of investment and a shift in the class of its residents, usually from lower class to higher class. And so I focused in on those mainly because of this temporal association of how neighborhoods became to be what they are. And I focused in on Metro Detroit because it's a metropolitan statistical area that has a large Black population, and then it has a lot of history there, especially large demographic shifts of Black folks moving from the South to the North to get out of Jim Crow era, but then there's still this history of housing discrimination going on.
And so you are interested in the effect of this discrimination on Black mental health.
Yes.
How did you measure that? What was the research you did?
So I measured redlining through the maps, the risk assessment maps. I measured gentrification through class shifts, shifts in like housing costs, and then I also included shifts in the total white population to really get at this idea of gentrification being a form of structural racism.
And then how did you connect it to mental health?
So at the scoping review, I was able to see a variety of mental health outcomes. So that included mostly precursors of mental health disorders, so like hypervigilance, stress, anxiety, these precursors to a lot of common mental health disorders. Then I also focused more specifically later on in my dissertation research on post-traumatic stress disorder.
And so how do you connect redlining and gentrification to post-traumatic stress disorder?
I conceptualized it as neighborhood environments really creating a lot of traumatic exposures to Black residents and not being able to have the resources to recover from their trauma exposures. And then also looking at it as this is continuous traumatic exposure. And that was also bound within these neighborhoods that had experienced housing discrimination. So using this housing focus, I was able to think about within the housing condition, so within the home, within the neighborhood, what's going on? Is there a lot of violence? Thinking about residential stability with consistencies. Are people leaving the neighborhood? Do you have your social support there? And then thinking about like cost as a stressor. If there's a lot going on in my neighborhood and I'm also stressed about costs, like how am I able to focus on these post-traumatic stress disorder symptoms I have?
This connection between housing and mental health has deep roots. What do you think can be done about it? I know maybe that wasn't the focus of your dissertation, but I wonder in doing this research whether you saw any potential avenues for undoing these connections.
Yeah, I think first we have to identify it. And when I used the geospatial methods, we were able to see areas that had co-location of like redlining and gentrification. So these are neighborhoods experiencing both. And just being able to, one, pinpoint those areas and then think about housing interventions. So I used a housing framework. We should think about housing costs and people's ability to stay in their homes, or just the conditions of the neighborhood. If these were like disinvested neighborhoods, so there's a lot going on with the units.
So you can really see where interventions can be targeted, for example.
Yes.
And do you think that it's a combination of housing and mental health interventions that are needed?
I do. I think what's interesting about my work is that it could be applied to other health outcomes. So focusing on physical health, we know there's a strong link between mental health and physical health, and that living in these housing environments can influence health across a range, right? But what I'm focusing on is housing is kind of the cause of those negative health outcomes.
So what comes next for your research?
I will be continuing my research here at Hopkins, doing a postdoc in the Department of Mental Health. So I'm going to expand this work to look at other mental health outcomes like substance use disorders, look at depression and anxiety.
And still in Detroit or possibly beyond?
So I'm going to start in Detroit, working with some of the data I still have from my dissertation. And then hopefully I'll be able to look at the relationship between redlining and gentrification across major U.S. cities, spanning all of that.
Now, earlier in this podcast, you said one of your reasons for studying public health was to make sense of what you saw growing up in Lansing. Do you think you are making progress in that goal?
I do. I think with the geospatial tools that I use for my dissertation research will allow me to see this connection across other cities in Michigan, including Lansing. So I'll be able to take a deeper dive there too.
That'll be particularly significant when you load up the Lansing dataset.
Yeah.
Good. Well, Dr. Smith, it is a pleasure to meet you. I really appreciate it. I'm always so impressed when I hear about the incredibly important work that so many people, and particularly the doctoral students, are doing at Johns Hopkins.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.